Hi, this is Dr. Connors. Welcome to the video that I'm putting together on the 3 phases of Lyme. You are going to download the book. So in this download, I actually separated the book picture there on your left-hand side, into 4 sections. This book is probably not going to be in print, so this is the only way that you're going to get this book. The 4 sections go over explicitly my protocols. What are the 3 phases of Lyme and what would you do about them? Now understand, in this book, I've created these protocols. We sell these protocols to our patients. However, if a person is a patient in our clinic, we get a little bit more specific. But we know that not everybody can be a patient in our clinic, and that's why we put this all together. So I just wanted to um, let everybody know what I do in my office, and so that they can get help by never coming to us, because I just know that one of the purposes God put me here for is to help people, and if I limit it only to people that can come to my office, then I really am not fulfilling that purpose to the best of my ability. So that's what this book is about. It's going to go over what are the 3 phases of Lyme. And if you have Lyme, commonly, most people think that there's only 2 phases. So that's going to be described in detail in this book. I also described it in my first book on Lyme, and it's also in detail on my next book in Lyme that's actually coming out next week. So by the time you're watching this presentation, it's already out, so you can download that too. That's called Lyme Brain. So that goes over if you have a lot of emotional and neurological issues with your Lyme problems, then make sure you download that book as well. These are all a free download, so it's anything to help people. That's what we're about. So when we talk about Lyme and the 3 phases, the problem with Lyme is always that Lyme is difficult to kill. It hides. It can meld with the DNA of commensal bacteria in your body and microbes in the body. It can take on a layer on its outside membrane and hide from an immune response. It gets into the cells intracellularly and hides there. So it's very difficult for your immune system to kill. And that's the problem with Lyme. Ultimately, it ends up going through these stages that we're going to talk about. And that final stage of Lyme disease is that autoimmune stage. That's that 3rd stage. So few people understand Lyme stages. Even Lyme literate medical doctors that are out there typically are treating it with high-dose antibiotics. And you know what that's going to do to your gut, to the rest of your body over a long period of time. It's pretty tough on it. So fewer people out there, even natural doctors, have a difficult time understanding how to treat an autoimmune disorder. We don't want to just support it. We still want to be able to kill the Lyme, and there's a way to do it. So I go over that in this book. These 3 phases of Lyme, as you're going to hear over and over in this book, are the acute phase. That phase 1 is the acute phase. This is the one I recommend you get antibiotics for. So I had Lyme twice. My daughter had chronic Lyme. She is in phase 2, and we've managed it in phase 2. Most of my patients are in phase 3. So I developed this out of just necessity. I was sick myself, my patients were sick, and I believe anytime God sends us somebody, we got to figure out how to get them better. Phase 1 is acute Lyme. You should treat it with antibiotics. Phase 2 is chronic Lyme. It's not yet autoimmune, but the bacteria has gone intracellularly, or it's adequately hiding from an immune response. These are the people that are very, very sick, but they're not yet in the autoimmune phase. You can still treat phase 2 Lyme with my protocol 1 or protocol 2, and that's with an herbal formulation. So I have put together an herbal protocol, actually 2 of them, protocol 1, protocol 2. You'll read all about it. And that can still be treated phase 1, phase 2. Phase 3 is a totally different animal. That's when you now have antibodies to your own self cells. Once your body has made antibodies to your own cells, now you can't use herbals, because every time you strengthen an immune response or stimulate an immune response, you're going to kill that which you have antibodies against first. And if you have antibodies against your neural tissue, against your brain cells and you spark an immune function, or you stimulate an immune function, you are going to kill that which you have antibodies against. That is, your own brain cells. So you can't do that. That's what makes it very difficult, and that's why these people are so sick. They are running around doing protocols that stimulate an immune response. That seems logical because I want to kill the Lyme, but you're helping your body kill itself. So I explain that you got to do it differently when you're in phase 3. So my protocols 3 and 4 are for this phase. Again, you'll read all about it on in the book. We have links to our website. This is one page on our website where it talks about the acute, chronic, and autoimmune phase. And even here a circle that says, what phase are you in? There's a way for you to click on it, and you can go and even take a quiz and find out what phase you're in. I understand this is the biggest comment that we get when we get calls from people with chronic Lyme. They say, I'm destitute, financially destitute. I've been working on this, trying to treat this for 10 years. I've lost my family, lost my job. I don't have any money. So we're trying to make this as economical as possible for people. There's lab tests that you can run. I explain it in the book. We have tests in our office that you can run. I explain that in the book. You're going to learn all about this. The book is free, so be thankful here. And then you can go on the website and take a phase quiz for free and learn about what phase you're in. And then follow different protocols. Or even if you don't purchase our protocol, you can see in the book I list everything that's in there, so you can follow it yourself. I'm trying to make this as valuable to you as possible, to reach the masses as much as possible, and as cost effective as possible. Because I've been in your shoes, I know what it's like. So on the website, you're going to see different pages. This is one of them. Dr. Connor's Clear Lyme Protocols. On here, we'll list out all the protocols, why we do this, what our purpose is. All these will be links in the book. You can go to our website there up in the corner and you can see them now. But don't get ahead of yourself. Read the book. So you'll get these sections. I broke the whole book out into 4 sections. You're going to get these 4 sections over the course of the next couple weeks. So every 4 days you're going to get another section. So make sure you check your spam folder, because it's going out to a lot of people, so it might go in your spam. Check your spam folder. Click on the book when you open up the email, and you'll open up the whole PDF of that section, and you can scroll through it, go to the links, check out different things, learn. That's all I care about. I want you to be a better person because of it. All right, I hope you enjoy it. That's what the cover of the book looks like. Enjoy it, and I hope it's a blessing to many, many people. Bye-bye.